A crisis in Indiana.
Fatal drug overdoses by the thousands.
More than 2,500 Hoosiers overdosed and died in 2021.
And one drug is proving to be especially deadly for our neighbors.
WRTV Investigates Rachel Wilkerson joins us live in studio tonight.
Rachel, you've been working on this story for weeks. Just how big is the drug epidemic?
Nicole and Mark, so far this year, more than 500 people have died from overdoses in Marion County alone. The coroner's office says nearly 80% of those deaths were from fentanyl. For perspective, there have been around 150 homicides in 2022, so deadly overdoses are outpacing deaths from violent crime.
We've seen the most deaths that we've seen in probably 10 years. Or more.
The opioid crisis is claiming the lives of Hoosiers at an alarming rate.
It's so sad to say that it's nearly every day and sometimes 3 to 4 times a day that we are investigating a drug overdose death.
Marion County Deputy Coroner Alfarina McGinty says Indianapolis is on track to shatter 2021's record number of overdoses. Her office has investigated 500 overdose deaths so far this year. Nearly 70 more cases are still pending toxicology results.
It is very scary, yeah.
McGinty says fentanyl, which is a powerful synthetic opioid that the CDC lists as 50 to 100 times more powerful than morphine, is the driving force behind these deaths.
The majority. Again, you know, fentanyl is mixed in everything, any pills that we see, any powdery substance that we see on death investigation scenes. Fentanyl is, by and large, one of the ingredients that is in those substances that are ingested.
What's even scarier for McGinty is she's never seen as many different strands of fentanyl being found on our streets and toxicology reports.
So it's not just one type of fentanyl or just fentanyl. There's probably 10 different analogs that we are seeing, and they impact people differently when they ingest them. So it's a critical issue that we can't really wrap our hands around how we deal with it.
A small amount can kill.
Just 2 milligrams of fentanyl can be considered a lethal dosage unit, just enough to maybe fit on the tip of a pencil.
Drug Enforcement Administration, or DEA special agent in charge, Michael Gannon, says fentanyl is made in China, shipped to Mexico, and then brought across the border.
And then the cartels take full advantage of that, and then they'll put that in all types of drugs, and then they flood the United States with the fentanyl, whether it's in a powdered form or in various pills.
Hundreds of thousands of pills and kilos of the deadly drug has come through the crossroads of America. Fentanyl is used in hospitals, but now Gannon says drug dealers are illegally experimenting in labs with higher and lower doses of fentanyl, lacing heroin, cocaine, meth, pain pills, and more. The pills often look identical to prescription medication.
You could put them right next to each other and you can't always determine the difference.
The drugs get passed from dealer to dealer. Many don't even know fentanyl is present until an overdose.
At the end of the day, they don't care about someone. They care about making money, an easy way, and if someone were to get harmed because of it, they look at it like, oh, well.
It's very devastating. I don't understand, or there's no human compassion, how anybody can put this drug out there knowing that it's killing so many people. I guess that overall, the money must be more important than lives.
Brenda Trent knows the pain this crisis is causing families.
He was my baby.
She lost her son, Carl Carnes, in June to an overdose.
It was a pretty bad scene. He'd been in the car for 2 days.
The 30-year-old was a father, son, brother, and husband-to-be.
He loved his mama, and he didn't hurt me, but I understood.
Trent says Carnes battled addiction for 15 years.
Went from Vicodin to the stronger Oxycontin. Then when the FDA or whoever pulled the doctors from prescribing that stuff, then it became the heroin. That's, but he was more than an addict. He was my son.
The Carnes family isn't alone in their grief. Marion, Lake, and Allen counties have the highest opioid death rates in Indiana, but every county is suffering.
So we just are trying to keep up. We're spinning our wheels. Toxicology labs, coroner's offices, medical examiner offices are essentially spinning our wheels trying to keep up.
McGinty says death investigations are at an all-time high. To keep up with the cost and high demand of death investigations,
we're looking at roughly close to $3,000 per investigation when you talk about all the time that goes into these types of investigations.
The Indiana Department of Health is pouring $1.5 million into county coroners' offices across the state. The state also received more than $29 million in federal grants this year for drug prevention, treatment, and enforcement.
There is no better time to spend these dollars to prevent the next crisis that's coming.
Investigators say although resources are in place, the grim reality is fentanyl isn't going away anytime soon.
So it's a critical issue that we can't really wrap our hands around how we deal with it.
To help curb this crisis in Indiana, the government and local organizations are spending millions on naloxone, also known as Narcan. It's a life-saving opioid overdose treatment available in all 92 of our counties. Paramedics tell me drugs laced with fentanyl are so potent, up to 4 doses of Narcan are being used to bring patients back to life instead of just the usual single dose. So that shows you just how powerful fentanyl is in our community.
It is amazing just to see that laid out in that way. So Rachel, tell us, how are the agencies working together to crack down on these dealers that are putting this in our streets?
They're tracking the compounds found in fentanyl that they're finding in the toxicology reports, and they're also keeping a close eye on trends. For example, earlier this year, nearly 50 people died in one weekend from overdoses, which sparked an investigation into if the bad batches were from the same dealer. Nicole.
Rachel, thank you. And agencies say when you risk your life every time you take a pill or drug not prescribed from a physician, there are resources available. In Indianapolis, Eskenazi Health has partnered with the group Overdose Lifeline. They have a naloxone vending machine available at Eskenazi Health Center on West 38th Street. Each kit inside the vending machine includes a single dose of naloxone, instructions for use, and a referral to treatment for substance use disorder. There are also Nalox boxes outside of Eskenazi Health Centers. This map shows those locations in our state. You can find this map on the website overdoselifeline.org.